Please be seated. Good afternoon. I'm Martin Filbert, the Dean of the University of Michigan School of Public Health. It is a pleasure to welcome you to Hill Auditorium on the University of Michigan Ann Arbor campus to celebrate the graduation of our 74th class, the class of 2015. Out of courtesy to everyone assembled here today, please turn off your phones, your ringers, your pagers, beepers, but please keep your pacemakers on. I'd also like to welcome those of you in our national and global audience who are watching this ceremony via web streaming. I'd also like to call out my mum and dad in their 80s, just outside London, watching me misbehave today. We are honored to have with us University of Michigan Regent Andrew C. Richner. Article 8, Section 5 of the Michigan Constitution of 1963 declares that the regents of the University of Michigan and their successors in office provide, quote, general supervision of the university. It is a duly elected and unpaid, yes, I said unpaid, position. Regent Richner hails from Grosse Pointe and is a double graduate of the University of Michigan, holding a baccalaureate in business administration and a doctorate in jurisprudence from this institution. Regent Richner was editor to the Michigan Law Review and is a partner in the law firm of Clark Hill PLC. Regent Richner has a distinguished career in public service as a Wayne State County twice, as a member of the Grosse Pointe Park City Council, was an intern in the Office of Counsel to the President in the White House under President Reagan. Regent Richner, great pleasure to welcome you to the school commencement and to invite you to address the graduates. Thank you.
Well, thank you, Dean Filbert. Very kind of you to give my resume to everyone. Wish my mother were here, actually, to hear that. I would just like to extend greetings on behalf of my colleagues on the Board of Regents and welcome all of you to this very special occasion. Under the state of Michigan's Constitution, the 8 members of the Board of Regents are elected by the citizens of the state to oversee the affairs of the University of Michigan. Among our responsibilities is to hire the president of the university, approve the budget, and set tuition. One thing we don't do is hire football coaches. So stop the emails. But perhaps most importantly for you today, we confer the academic degrees based on the recommendations of faculty and deans. Dean Filbert has informed me that the School of Public Health students here today are particularly distinguished. We on the board are very proud of the many students who have graduated from this program over its illustrious history and gone on to achieve great success in their careers. Congratulations on your achievements. Job well done.
Thank you for those kind words. We are also delighted to have with us here today our colleague and friend, the University of Michigan Vice Provost for Academic and Budgetary Affairs, Professor Al Franzblau. Professor Franzblau, we are delighted that you are here to celebrate with us in your dual role as Vice Provost of the university and as one of our very own School of Public Health faculty members. Vice Provost Franzblau, please stand and be recognized. Thank you both for your ongoing support of our School of Public Health and our mission. This is the day when we celebrate the achievements of every student who has earned a degree at this most distinguished institution. Public health has been a part of the University of Michigan curriculum since 1881, and our School of Public Health has been at the forefront of public health education and research since 1941, when the school was formally chartered. We are consistently ranked amongst the top schools of public health, and not just here in the United States, but I would say across the world. But that's just me. A key reason for our strong reputation is our ability to address complex challenges through innovative interdisciplinary research and training. Faculty in our Department of Health Management and Policy are playing a major role in improving healthcare delivery in this country and also abroad. Our Biostatistics Department leads the nation in statistical genetics research, reinvigorating and expanding our understanding of both chronic and infectious disease. A project launched just a few weeks ago will enable us to learn more about our individual DNA and how we can use that information to achieve better health. Members of our Department of Health Behavior and Health Education are internationally recognized for their visionary work in health communication as well as community-based participatory research. In our Department of Epidemiology, we are addressing the growing concern of healthcare infection control, how to prevent and control epidemics, and the effects of health disparities both in this country and abroad. In our Environmental Health Sciences Department, we are pioneering innovations in research and practice to get clean water to the developing world, to address global warming, and to eliminate biofilms that are costing us billions of dollars. In our health informatics program, we are preparing leaders who can combine information technology and health science to solve complex problems at the level of health systems as well as in individual health outcomes. And in our new Department of Nutritional Sciences, we are intensifying research and scholarship to study obesity, global hunger, and the role of nutrition in managing chronic disease risk. Public health challenges are large and complex. I offer the following examples of just a few of the challenges and the innovations that are now underway at our school. In studying air quality, we're learning more and more about how airborne pollutants contribute to disease, not just respiratory diseases, but other chronic conditions such as diabetes. This issue is so important that SPH researchers are collaborating with colleagues from Michigan State, wait for it, and Ohio State University. It's true. Using mobile exposure laboratories, they are assessing the impacts of air pollution exposures in Detroit as well as in rural areas. In a project entitled Genes for Good, Professor Gonzalo Abacasis and colleagues are using social media, specifically Facebook, to generate and analyze an enormous database of health and genetic information. Their research will provide valuable biological insight into the causes of common diseases and thus inform treatment and prevention efforts. How cool is that? Childhood obesity is a global problem. Through our Children's Environmental Health Center, Professor Karen Peterson is collaborating with faculty in pediatrics and with Mexico's National Institute of Public Health to understand how early life nutrition and exposures to toxicants affect childhood obesity and metabolic syndrome. In the area of mental health, we now know that many people experience the first symptoms of depression during their college years. You know this well. The University of Michigan Healthy Minds Network, directed by Professor Daniel Eisenberg, is helping to prevent and treat depression and other mental health issues in more than 400 colleges across the country. Kidney and organ transplantation. It's estimated that the number of people with kidney disease will surge as diabetes and hypertension increase amongst American adults. Under the direction of Professor E. Lee, the University of Michigan Kidney Epidemiology and Cost Center is improving clinical practice and patient outcomes, optimizing resource utilization, and informing public policy regarding organ failure and organ transplantation. Tobacco use, sadly, is still the leading cause of premature and preventable death, responsible for more than 480,000 deaths a year in the United States alone. The emergence of e-cigarettes poses new questions in our efforts to reduce the tobacco epidemic. The School of Public Health faculty are on the front lines of this debate. Lest you wonder, the innovations fostered by the school are not confined to our Ann Arbor campus. Graduates from every department of the School of Public Health hold leadership positions in governmental public health, in healthcare systems, and in the private sector companies in every state in the Union, and in over 109 countries. Last year, SPH graduates, some of them as recent as the class of 2014, served on the front lines of the Ebola outbreak response. Within months of crossing this very stage, in their cap and gown, they were deployed to West Africa to save lives. I know that today's new graduates will carry on the school's legacy of excellence and innovation in contributions to public health. Graduates, you have been remarkable students, and we are pleased that you chose the University of Michigan School of Public Health for this phase of your education. For all of you wonderfully supportive relatives and friends, let me tell you just a few things about the class that is graduating this weekend. They number 359, and soon they will become the latest members of an alumni body exceeding 15,000 people. It's true, I tried it. You can go anywhere on the planet and shout, "Go Blue," and somebody will know where you're from. So don't misbehave. Our new graduates come from a remarkable, are you ready for this? 226 universities and colleges throughout the world. Our graduating class includes citizens from 19 countries outside of the United States, including, and you can give if you hear your country, Belarus, Brazil, Canada, China, India, Iran, Iraq, Israel, Nigeria, Pakistan, Republic of Korea, Russia, Rwanda, Saudi Arabia, Senegal, Singapore, Sudan, Taiwan, and yes, God save the Queen, the United Kingdom. The single largest contingent of graduates comes from the University of Michigan, but in the ecumenical spirit that characterizes our school, we are pleased to acknowledge that many of our new graduates did their undergraduate work at Michigan State University. Yeah, go on. And I also hear tell that there are a couple of Buckeyes lurking in the shadows of this historic auditorium. No. All are welcome. Each year, 2 graduating students speak at this ceremony. On behalf of the entire graduating class, it is my pleasure to introduce the first of this year's speakers, Fas Malik, an MPH candidate in epidemiology. Fas.
Thank you, Dean Filbert. Good afternoon, graduating class of 2015, and all who have supported us on this journey. We are united today as we all share a desire to advocate for public health and the prevention of disease. As I contemplated this graduation speech, I thought about the term public health and what it means to me. We live in a world where we see and hear about various public health issues and achievements, be it the Ebola crisis in West Africa, the recent measles outbreaks across the US, implementation of the Affordable Care Act, awareness campaigns to end teen smoking, the push for nutritious meals for children around the world, and just this past week, the devastating earthquake in Nepal. Public health is changing, and it's powerful, and we are the next group of leaders to champion it further. Many of us had the opportunity to travel and experience public health outside of the classroom. I myself recently had the privilege to go to Grenada with the Public Health Action Support Team. For our project, my research partner and I met with local Grenadians and discussed their thoughts on gender dynamics, reproductive health, and access to healthcare. Through the simple act of conversation, we expanded our definition and learned that there is always more to do in the world of public health. As leaders, this is our job. We understand that race, gender, socioeconomic status lie at the root of many health issues. And although the thought of fixing these issues may feel overwhelming at times, we must remember to stay motivated and passionate. There are people out there who need us to help make their lives better. And now, class of 2015, I ask, how will we define public health, and how will we go forth in advocating for it? Some of us will go on to work in hospital administration and seek innovative solutions for access to healthcare. Some will travel abroad, promoting health and education to better the lives of individuals in other countries. Some will tackle the pervasive issues surrounding climate change across the globe. Others will move on to further education. And some of us are just trying to figure it all out, and that's okay. Whatever it is that drives you, though, find it, hold on to it, and stay true to it. A few months ago, Justice Ruth Bader Ginsburg delivered the Tanner Lecture right here in Hill Auditorium. After a thought-provoking discussion on social justice, human rights, and women's empowerment, Justice Ginsburg left us with some final words of motivation and encouragement. She reminded us to do something outside of ourselves, to repair the tears in our community, and to serve others. And it occurred to me, this is public health. This is what we have been trained to do. We are a group of talented leaders who not only survived a polar vortex twice, but who are restless and ready to make the world a better place. We have the tools, we have the drive. Now let's go out there and do it. Congratulations, class of 2015, and go blue.
Thank you, Fas, for those words. It is now my pleasure to introduce the second of this year's student speakers, Jenna Coulson, a PhD candidate in epidemiology. And while she's walking up, I thought I would sing for you. Perhaps not.
I think everyone's a little sad that we didn't get a song now. Hello, everyone, and happy commencement to the class of 2015. It's interesting that we call it that, commencement, a beginning, as though being a student means you haven't really begun life yet, as though the process of learning is somehow innately separate from the process of doing. Now, everyone here has commenced at least a few times, and yet here we are, recommencing. And maybe the thing that keeps bringing us back to school is the same, the desire to know more, and then the slippery slope of realizing that there is always more to know. Many of us were interested in public health, idealistically, because it has such a vast potential for positive influence. We're not just going to help a few individuals, we're going to help whole cities, whole countries, the world. So we came to the University of Michigan, and we studied. And the more we learned, the more we realized we don't know. Because for every skill we developed or concept that we learned opened new doors to all the things that we didn't even realize we didn't know. That's part of why education is so addicting, and exactly why commencing life should never mean the end of education. Maybe we should beware of the day when we feel like we understand a thing completely, because it may just mean we've learned just enough to be ignorant of our own ignorance. But the corollary is this: it's okay to not know everything. We should keep learning, yes, even after commencing. But we don't have to wait until we're finished learning to commence doing. So what do we do? Because the heart of every lesson I've learned in my years at SPH was this: there will be no easy solutions. There are no magic bullets in public health. There are reasons, deep, structural, interlocking reasons why these problems haven't been solved already. I'm sure each of us has our own examples, but my studies were related to malaria. For malaria, even if someone developed the most perfect drug tomorrow, cheap, safe, effective, malaria wouldn't disappear immediately. We'd still have to face all the challenges of access and distribution, storage and efficacy, public opinion and compliance, asymptomatic reservoirs of infection, and all the while, there's basically a countdown clock ticking until that wily parasite develops resistance. Our solutions are not going to be simple. Sometimes the solutions we come up with might not even solve anything at all. But then again, sometimes, just maybe, we'll find that way to do a little bit of good. Or even better, let's get a lot of people to do a little bit of good. Because I think there's actually a kernel of hope. We have one huge advantage over everything that's come before. We are riding the wave of an explosion in technology, access, communication, and interconnectivity. Public health hasn't come close yet to fully tapping the potential of what this could mean. While social media has certainly demonstrated that we are obsessed with trivial things, it's also shown that we can connect almost immediately to a lot of people, most of whom really would like to help improve the world in some way. Millions of people willing to dump an icy cold bucket of water over their heads, if only they know what they can do that will help. So we have unprecedented technology and unprecedented access to millions or even billions of people. I think if we can find some solutions for them, some way to take action, we can get each of these millions of people to do a little bit of good. And maybe there's more hope in that than there's ever been. So it won't be easy, but University of Michigan, class of 2015, let's go out there and find everyone some solutions so that we can each do just that little bit of good. Congratulations, and thank you.
Thank you, Jenna, for those words. The members of the School of Public Health faculty, staff, and student body who are here this afternoon represent the dedication and excellence of our School of Public Health community as a whole. And we'd now like to take just a few minutes to recognize two of them with the conferring of awards for excellence. The Excellence in Teaching Award. A long-standing tradition at graduation is announcing the recipient of the school's annual Excellence in Teaching Award. Faculty are nominated for this award by their faculty peers and by their students. I am pleased to announce that the Excellence in Teaching Award is presented this year to Jose Baumeister, the John G. Searle Assistant Professor of Health Behavior and Health Education. Before Professor Baumeister accepts this award, I want to share some of what his colleagues and students had to say about his teaching. From a faculty colleague. Dr. Baumeister has taught 7 different courses since joining the department and offered numerous independent studies and research credits for our MPH and doctoral students every term. His generosity and flexibility in meeting the needs of our students is exceptional. To top it off, he is an outstanding mentor who sets the bar very high for the amount of time, encouragement, support, guidance, and hands-on training he provides our students, end quote. And here are some of the comments from his students. Dr. Baumeister strived to foster a safe learning environment where students could ask the most basic to the most complex questions while feeling that all questions were equally valuable, end quote. His grading was fair and clear, often accompanied by encouraging notes and constructive feedback. Quote, the effects of Dr. Baumeister's dedication will resonate for years in the careers of hundreds of former students. And this one from a former student, now alumna. I've learned how to conduct myself in a meeting, how to look at a problem from a new angle, and the importance of sharing my time with younger colleagues. It is for all these reasons that Dr. Baumeister stands out as one of the great teachers in my life. Professor Baumeister, on behalf of the students and faculty of the School of Public Health, it is my pleasure to present to you the School of Public Health Excellence in Teaching Award. The Outstanding Graduate Student Instructor Award. This afternoon, the School of Public Health begins a new tradition with the awarding of the Outstanding Graduate Student Instructor, or GSI, Award. We are privileged that the school has so many GSIs who demonstrate a passion for sharing their knowledge and experience, making the educational experience a better one for their fellow students. These young scholars and researchers partner with faculty instructors. They combine innovative scholarship and research with superb teaching and mentoring. They recognize the humanity of their fellow students as they maintain rigorous intellectual standards and model professional integrity. There are 3 criteria for receiving the Outstanding GSI Award. 1, the GSI must be a highly engaging and effective lecturer in discussion sections. 2, the GSI must be an effective grader, one who teaches students through the process of providing useful feedback on exams and assignments. 3, the GSI must demonstrate mentorship, including generous willingness to devote time to helping students outside of the class. I am pleased to present the inaugural GSI Award to Emily J. Ewart, a doctoral candidate in health behavior and health education. Here's what a student colleague and faculty had to say. From a fellow GSI, Emily approached teaching with a very student-centered approach, difficult to master at all levels of teaching. She was always thinking about what would work best for her specific students, how we would meet them where they were and push them forward. I was able to watch Emily engage with her students on several occasions, and it was clear that her students both respected and enjoyed her. Quote, Emily is absolutely wonderful. Not only does she care that each student learns about public health, but she goes beyond the classroom for all of her students. She has gone above and beyond and helping me secure a public health internship this summer, and I cannot thank her enough for it. Quote, Emily maintained a comfortable and energetic atmosphere in class, allowing it not only to be incredibly informative, but also relaxed and enjoyable. And these from faculty instructors. Let's start with the basics. Emily is very smart, hardworking, and a great team player. She was adept in providing insights to the faculty as she was in communicating to students. And from another faculty member, she is my co-equal collaborator. She has been the inspiration for aspects of the course that has distinguished it from introductory courses at other universities. She is the driving force behind keeping the course fresh and on track. Emily, on behalf of the students and faculty of the School of Public Health, it is my pleasure to present you with the University of Michigan School of Public Health's first Outstanding Graduate Student Instructor Award. And now I have the distinct honor and great pleasure of introducing our commencement speaker. See, I'm excited. Sekou Andrews. As you may have surmised from your description in your program, Sekou is not your typical graduation speaker. I think it's safe to say that he will not be talking to us today about statistical outcomes. I know you're disappointed. Studies or case-controlled clinical trials or community interventions or many of the other countless but incredibly important constitute public health in action. That's not his style. What I do think it's safe to predict, however, is that Sekou will stir things up a bit, because that's what he does. That's why people from Norman Lear to Quincy Jones to Barack Obama and the family of Martin Luther King Jr. have asked him to perform for them. It's why organizations like Blue Shield, Kaiser Permanente, and the Mayo Clinic have turned to Sekou when they needed a jolt of inspiration. It's why we brought him here to the School of Public Health last year to give the keynote at our first ever Innovation in Action competition. And it's why we invited him back this year to share his voice with an even bigger audience. Your program notes will tell you lots about Sekou's credentials and achievements, his appearances on Oprah and ABC World News and MTV, his work for Nike, Time Warner, Microsoft, Google, and many other industry leaders, his two-man spoken word play, and his critically acclaimed recordings. You've got to go on the web and see his free offering, Awesome. You'll walk around for some of you have seen it. Awesome. You'll look at it, you'll see what I mean. You'll read about his unique career path from elementary school teacher to actor, musician, two-time national poetry slam champion, entrepreneur, and award-winning poetic voice. But what your program won't tell you is that Sekou's unique trajectory began at birth. Sekou discovered not long ago that while he was being born, his father wrote a 7-page poem about him. Is it any wonder that this inspirational infant grew up to be a full-time poet, who purchased his first home with poetry, proposed to his wife with poetry, and he assures me he will not be making a proposal today. Maybe he will. All of this gives you some idea of the extraordinary man who is with us on stage today. But there's another reason we wanted him to speak to you, the graduating class of 2015. And that's because Sekou Andrews understands the world into which you will enter and the challenges which you will face. When he spoke at the School of Public Health last year, he talked movingly about the field of healthcare and public health and why they matter so much. He talked about his troubled past with the healthcare industry. Healthcare, he said, was, quote, all my healthcare dates were terrible communicators who spent the whole time talking, not listening. They were only interested in Western subjects. They'd forgotten the humanity of care. They were much more interested in the mathematics. But then his luck changed, and he met a new kind of healthcare date and fell in love with our profession. Like you, Sekou has seen how inspiring our work can be. He knows what it means to witness the direct impact of life-saving work, of work that makes people feel worthy, of work that restores humanity, of the often anonymous work of crunching numbers and conducting trials and collecting survey data that we can make a difference with in this world. That's what Sekou is here to talk to us about today. Please join me in welcoming him to the podium.
Ladies and gentlemen, faculty and staff, parents and grandparents and friends and play sisters and third cousins on the father's side and little babies who have no idea why you're here, and the graduating class of the School of Public Health of 2015. I welcome. I am here today for one reason, and one reason only, now that my mic is on. I'm here today to update you on the status of the public health outbreak that is spreading across this nation at an alarming rate. It is fierce, and it is quiet, and it is reaching epidemic proportions faster than we can even keep up. Reports are still coming in daily from every state, like the recent reports of a woman in Santa Ana, California, who is transmitting chronic illness education door to door throughout her local neighborhoods. In Washington, the outbreak has apparently gone airborne, where a policymaker is mutating the strain of healthcare costs on the country. A local college professor is reportedly using an app to spread pathogens of purpose to entire digital populations. This damage these cases is doing is to blight and affliction is staggering. There is a husband and wife out there, a husband and wife team casting a net of safety over sub-Saharan Africa and completely undoing all the hard work that malaria has put into infecting people in that region. Malaria is not happy about this at all. Everywhere we look, we are finding cases of these infectious agents of public health whose impact on local and global communities is somehow managing to go more viral than cat videos and Kardashian clips. This is ridiculous. And the source of the health outcomes has baffled leading authorities until now. That's where I come in. Let's just take a minute to address the elephant in the room that everyone is wondering about. What in the world is a poet doing speaking about public health? I get it. It's cool. I get it. I'm not a healthcare professional. I'm not a doctor of oncology, a doctor of philosophy, even a doctor of love. I am not only not a doctor, I don't even play one on TV. So why in the world am I here? It is simple. I am a specialist. I am the asset that is called in when all other efforts to locate a source have failed. I am here because I am a storyteller, which means, not to get all Liam Neeson and Taken with it, but I have a very particular set of skills. Skills I have acquired over a long career. Skills that make me an expert at finding the common thread within a story, the universal truths that lie between the isolated incidents. And there is indeed one, a common thread that connects these acts of improved public health. At first glance, beneath the act, the thread appeared to be a belief system, right? Woven through each incident, the genuine belief held by a select few that health should not have an ethnicity. It should not have a gender or a skin color. It should not have a zip code or a tax bracket or be protected behind the gates of a private community. True health should be public, accessible by all, and provided with all in mind. But as I dug even deeper, I found beneath the belief system that there was this commitment held by those infected with this belief system. And I found this unbelievably unwavering commitment to total health. Despite staggering odds, I found this quiet, courageous commitment to making as many individual lives as healthy as possible. Despite gut-checking obstacles, I found these people had some heroic, stubborn, delusional commitment to improving public health for the whole population. And just when I thought that was it, that was as deep as it got, I hit the core of this epidemic of better health. And what I found was a 75-year legacy of landmark achievements in public health and an army of almost 15,000 public health soldiers stationed all over the world and who were trained in Ann Arbor, Michigan. And I found almost 400 new health warriors armored in caps and gowns, poised on the edge of their seats, ready to throw down, ready for their debut, their journey to pursue a new goal for healthcare that's long overdue, to help communities do more than just make do, but make new healthy choices and to repeat them like deja vu, ready to spread a holistic view of wellness like the flu and leave their mark on the world, a total health tattoo, a mob for good, a caregiving crew ready as if on cue to revolutionize prevention like a healthcare coup, ready to recolor healthcare with their bold blue into the world like a cold blue, ready to resuscitate the public's health as if it was starting to go blue. What I found. What I found at the source of this healthy outbreak was you. I'm sorry, hold on a second. How you doing? Was that all right? You good? Okay, good. I just want to make sure. Take a break, rest the fingers. I see you had to switch it out. Let me know. I found you. You are the ones who are putting this whole world at risk of being the healthiest it has ever been. And the reason blight and affliction find you so threatening is because your appetite for improving health conditions is so enormous. Your public health mission is gargantuan. Your world-changing ambitions are just ridiculous, really. They really are. I mean, they really are. Come on. The whole world, really? You know how they say you can't please everyone, right? You can't please everybody? Right? You know how they say that? No, you don't. No, you don't. You all are apparently the only ones in the world who don't know that phrase because you are dedicating your lives to pleasing everybody. While others work on personalized medicine, you are tackling population medicine. You are staking your careers on healing everybody out there. Others focus on making one person the picture of health, but when you focus on health, you only see the big picture. You are setting your sights on improving health outcomes for everybody in this room. The ladies and the gentlemen, the faculty and the staff, the parents and the grandparents and the friends and the play sisters and third cousins on your father's side and the little babies who have no idea why they are here. You all are the ones who will make us all better. Babies feel me. Babies understand me. And that kind of ridiculous, your kind of ridiculous, yeah, I'll take it. I'll take it because I know that the most awesome-fied people on the planet are we who embrace our ridiculousness. We live what we love, and we love incorrigibly, which is why I sleep quite well. You sleep quite well. We all sleep quite well, but we go to bed horribly, right? Which is why you will stay hopped up on a triple shot of purpose, juggling your dreams like 13 flaming swords and chasing your aspirations through the graveyard shift so that the world can awake to your awesomeness. Look it up. And that is why you will stand up today and walk across this stage into your careers. And you will thrust yourself into noble and passionate pursuit. And you will find yourself in the near future arguing with some senator after she changed her vote last minute on the safe housing bill that you spearheaded, or on sick leave with a rash because you didn't notice the tear in your latex gloves, so you ended up catching the virus that you were at the factory to keep the workers from catching, or standing in a field covered in rain and dirt and goat poop after helping goat herders in the Philippines rescue their flock from the floodwaters. And as you are in your bathroom, your hotel bathroom later that night, cleaning goat poop from your fingernails, you will think to yourself in that moment, this is not sexy. But hey, you didn't get into public health because it was sexy. No, if you wanted sexy, you would have become a neurosurgeon, okay? You chose this path because you are the few bold enough to believe that you can do a whole world of good. And that audacious charge is not without its own perks and benefits. I mean, you have not partied until you have partied in the Philippines with sheep herders who just saved their flock from a tsunami. They get down. And that neurosurgeon is not invited. Huh? You're welcome. And no, you may not all get rich from this calling, but this career is not about the money. It's about wealth. And your health is your wealth. So you creating the healthiest people creates the wealthiest people, right? And gives them more time to spend. And since time is money, and you're giving people more time, well then better quality time makes them rich. So basically it is about the money, because now money has been redefined as family and wellness. It's about service and time. It's about keeping your pockets full from collard greens, because your career only eats soul food that's holistic and nutritious, off investments that are rich with more lettuce and liquid, less this, more ease, less multiple choice, more E, all of the above. Improved health outcomes for all of those you love. And that won't be easy either. It won't be sexy, it may not make you rich, and it won't be easy. But if it ever starts to feel too hard for you, then I want you to hold on to this gift that I give you now to help you get through. Okay? Remember this inspiring and empowering phrase, and let it be your mantra to help you manage those impossible days. Everyone repeat after me right now, graduates. At least I'm not trying to build a successful career from poetry. I got no sympathy for you. I got no sympathy. Oh, is it hard? Oh, is public health hard? Please. I built my business off the dead art form you hated in high school. Get over it. And as if that wasn't hard enough, then I went and created Poetic Voice, which is a new type of speaking category that fuses inspirational speaking seamlessly with spoken word poetry to help the world's most powerful organizations tell their most powerful stories even more powerfully. So I may not be a doctor or play one on TV, but as a poetic voice, I make my living showing doctors and nurses and patients and executives, individuals and organizations the best version of themselves so that they can live into it. So I know what it feels like to stand here at the precipice of a great challenge. I know there may be far too many days when you feel like you are just beating your head against that proverbial wall, when the incredible work that you do for the good of the world seems to go unnoticed by the world, when you feel unseen. So today I want you to begin your journey knowing without any doubt that we see you, that we thank you, and we celebrate you. In fact, I'm done talking to you. I'm not done talking to you. I want to talk to you real quick, okay? I want to talk to the world that you're helping for a minute. Let me talk to the families and the friends and the third cousins on the father's side. Families, are y'all out there? Make some noise. Okay. Now, families, some of you, let's just be real talk for a minute. Some of you may have no idea what public health professionals really do, right? Right? I get that. You just got the graduation invitation. You're like, Aisha's graduating, let me just go, right? So I'm going to help you out now, okay? You've all heard the phrase, an apple a day keeps the doctor away, right? Right? Okay. It's timeless, right? It's timeless. It's simple and elegant. It's sexy, you know? Almost poetic. It rhymes, right? It's sexy. But public health manages all of the incredibly complex and convoluted problems that allow that simple, elegant solution to just roll off your tongue. That is what they do. See, before the apple a day can keep the doctor away, somebody's got to make sure the apple is clean. Right? right? That the apple was washed with clean water, free of any bacteria that could make that apple send you running back to the doctor. That is them. Before the apple a day can keep the doctor away, somebody's got to work with the ports to regulate the shipping protocols that ensure the apple is fresh when it arrives to market, and make sure there are enough markets nearby for every community to have access to the apple. That is what they do for us. And it may not be sexy, but your son will make sure the asbestos from that building being torn down doesn't seep into the soil of the apple orchard next door, and I am grateful to him for that. And it may not make her rich, but your sister will facilitate the partnership between the district and the suppliers to put the apple in the vending machines at schools instead of cookies, and you gotta love her for that. It may not be easy, but your third cousin on the mother's side will help with the grocery insurance initiative that allows low-income patients to buy the apple that is prescribed by their doctor with a copay, and we should be praising them for that. And you little babies, where my babies at? Make some noise. Who are acting like you have no idea where you are. Somebody's got to make sure the restaurant workers wash their hands before serving your apple slices, and the processing plants don't make sure that your apple sauce is not made with unsterile equipment, and the manufacturers package your apple juice in plastic containers that are free from deadly toxicants. And I don't know about y'all, but I think that these public health graduates should be always and constantly celebrated for that for the rest of their lives. I think it should start right now. Let me hear it. Let me hear it. Let me hear it. Let me hear it. And that is why I'm here. You're welcome. I am the specialist brought in to not only help you celebrate the next chapter of your story, but to remind you of the importance of telling your story. That is what it does. The world is not going to tell your story. Because if you've done your job right, most of us won't even know that you were there. So you have to become the powerful voice for the powerful work that you do. I train executives on how to become more dynamic communicators and be mighty on any stage. And one of the mantras I tell the folks in my speaker training programs is that a great story depends on your ability to tell it greatly. Your work is what will make your impact felt by this world, but your story is what will make your impact contagious to this world. Make your light spread from one to many, from personal to public, and inspire the world to hope and to believe and to wish upon you like a star that is shooting across the vast landscape of the universe, set on gifting light to each corner of it. And sure, maybe there will always be some dark corner that remains unlit. You know? Maybe the light from your shooting star will never illuminate the entirety of this universe, but the shooting star doesn't really care. Maybe she's just hardwired to try. What if she just wants to shoot through the night sky, inspiring as many wishes as possible before her spark fades? What if fire just wants to donate its flames to ignite change in the inflammable spirits of those standing within reach? What if rain wants nothing more than to fall, each drop gambling its entire existence on the hope that despite how broad the surface of this world, despite the odds against it, that it might land on a seed thirsting for growth, that it might be the reason for the flowering of a rose, that it might become the rose that eventually becomes a garden, that ultimately makes a community a better place to live. Either way, it will always be greater than itself, the moment that it makes impact with the world. So this is my charge to you today. As you stand upon this mighty hill, I charge you to descend upon this world with the full weight of your passion. Collide yourself against this path with the full force of your mighty ambitions. Fall into this calling heavy with purpose and be nothing less than contagious. You do-gooders of the world, doing a world of good. This world is standing before you with open arms, ready to receive your impact. And the best it could ever do is catch a little bit of you. So know today that we give our thanks to you for your infectious spirit. We give our thanks to you for your communicable passion. We give our utmost thanks to you for the path that you have chosen, because if you continue on your current course, you will put communities in danger of achieving total health. If you keep up this quiet courage of yours, you will put each of us at risk of having fewer reasons to get sick. University of Michigan School of Public Health graduates of 2015, if you do not change your ways, you will leave the entire population of this planet vulnerable to improved health outcomes for all of us. For all of us. The ladies and the gentlemen, the faculty and the staff, the parents and the grandparents, and the families and friends and play sisters and third cousins on the father's side, and the little babies who have no idea why they are here and have no idea how bad it could have been, but will have the pleasure of growing up in a world that is the stunning picture of public health. Thanks to you. Congratulations. Congratulations. Thank you. Thank you. Thank you. Congratulations. Oh, thank you. Thank you. I'm proud of you. Go get them. Go get them. Thank you all.
Wow. Wow. If any of you are wondering why you are here, wonder no more. And now for the moment you've all been waiting for. Presentation of the candidates for degrees from the University of Michigan School of Public Health. Associate Dean for Research, John Meeker, will present the candidates for the degrees of Doctor of Public Health and Doctor of Philosophy. During this recognition, candidates will carry their hoods to the stage and will be draped with the hood by a member of the faculty. Senior Associate Dean for Administration, Sharon Cardia, and Associate Dean for Practice, Phyllis Meadows, will present the candidates for Master of Public Health. Associate Dean for Practice, Phyllis Meadows, will present the candidates for Master of Health Informatics. Senior Associate Dean for Global Public Health, Matthew Bolton, will present the candidates for Master of Health Services Administration and Master of Science.
Dean Filbert, it is my pleasure to present the candidate for the degree of Doctor of Public Health. Yasmina Marie Burwawi Karwi, evaluation of cost implications of an asthma healthy homes intervention program. Dean Filbert, I'm now pleased to present to you the candidates for the degree of Doctor of Philosophy. Jenna Coulson, silent malaria, defining the infectious reservoirs of Plasmodium falciparum in communities of southern Malawi. Katrina Renee Ellis, dyadic analysis of the influence of chronic conditions on the biopsychosocial well-being and health-promoting behaviors of individuals with advanced cancer and their caregivers. Shuang Feng, design and association methods for next-generation sequencing study. James Anson Fuller, emerging issues in sanitation, herd protection, sharing between households, and joint effects. Iman Hassan, the effect of trichloroethylene on adverse birth outcomes. Minna June, epidemiologic approaches to understanding mechanisms of cardiovascular diseases, genes, environment, and DNA methylation. Michelle Marie Johns, overlooked assets, body size, body image, and sexual minority women. Dana Johnson, the social patterning of sleep in a multi-ethnic population, associations of socioeconomic position, neighborhood characteristics, and psychosocial stressors with sleep. Alana Maydeen Woolley LeBron, racialization of Latinos and implications for health following September 11th. Findings from a northern border community. Ryan Maloche, acute respiratory illness in households with children, factors associated with influenza vaccine receipt and viral interference. Helen Meyer, life course socioeconomic status and immune response to persistent infection in Mexican Americans. Rana Hisham Moosley, SIP composition, mealtime behaviors, and the weight status of early school age children. Hadi Brombley, health changes after diabetes diagnosis in middle age and old age, physical, mental, and cognitive health trajectories and social stratification. Joden Platt, public trust in health information systems, a strong fabric or the emperor's new clothes. Moshgan Rajai, mercury exposure, cardiovascular health, and pulmonary function in a small-scale gold mining community in northeast Ghana. Carrie Lynn Sant, acute embryotoxicity of mono-2-ethylhexylphthalate in mice, nutrition, epigenomics, and environment. Donald William Sexton, implementing evidence-based practice within a quality improvement collaborative, a multi-methods analysis of the facilitators and barriers to implementation. Jin Chen, estimating treatment effects and identifying optimal treatment regimes to prolong patient survival. Neha Sheth, investigation of the relationship of statin medication use, fasting blood glucose levels, and type 2 diabetes mellitus. Najika Shrivastava, understanding disparities in vaccination coverage among Indian children. Elkanza Saeed Ahmed, benefits of a Mediterranean diet on the prostaglandin E2 enzymatic pathway among individuals at high risk for colon cancer. Jonathan Vivoda, the influence of the built environment on the driving behaviors and mental health of older adults. Abram Wagner, control of measles and pneumococcus in urban China. Christine West, impact of duty-related injury on mental health, maladaptive coping, and sleep disturbance among police officers. Adam Wilk, 3 studies of variation in medical decision-making and care delivery by physicians. Jeffrey Wing, air pollution and stroke in a bi-ethnic community, associations with incidence, recurrence, and stroke severity. Akila Wise, educational advantage and unintended pregnancy. Yi Yang, robust methods for estimating the mean with
Dean Filbert, it is my distinct pleasure to present the candidates for the the Masters of Public Health. And if this falls, it's not my fault. Masha Kuznetsova. Allison Bretz. Caroline Herian. Ben He. Jeannie Liu. Kelly Ruth Surfling. Katrina Burns. Babek Kasemli. Alana Elkin. Taichi Murata. Fridi Gonçalves Shisaga. Bin Shin Chao. Shu Chen. Wan Xin. Perta Hatamatazada. Clifford Fossmore. Patrick James Albertus. Vijaya Arun Kumar. Aaron Brody. Esperanza Felicidad Cantu. Lauren Marshall. Thomas Sherwood. Jamaica Robinson. Hannah Meyer. Tamara Rushovich. Chelsea Fu. Stephanie Phillip. Janelle Stokely. Hannah Segaloff. Christine Ann Regal. Anne Frick. Elizabeth Boyd. Deepti Beda Umpadi. Ki Su Chang. Nalinga Huang. Yi Huang. Jinye Yun. Bani Saluja. Catherine Helmick. Michelle Long. Rachel Galante. Michelle Mapson. Elise Marie Colbert. Derek Adger. Charles Zhao. Caitlin Leifert. Erica Lee. Christina James. Aisha Naz Ahmad. Margaret Louise Traeger. Catherine Alcott. Elena Patrice Rosenberg Carlson. Christina Halverson. Jacqueline Royer. Laura Miller. Catherine Cerno. Alexandra Kennedy. Miranda Michelle West. Jasmine Page. Melanie Ward. Yi Fan Wu. Sarah Lumar. Micah Aaron. Letitia Mason. Brianna Holland. Bianca Lawrence. Christopher Indubizu. Pamela Johnson. Kayla Getz. Kayla Vanden Eschert. Alex Reardon. Douglas Strain. Jillian Schrager. Megan Mullins. Ian Sholok. Sanya Masood. Nandakishore Kappa. Anna Sodiv Sodanov. Oh. I know. I practiced this all night. Sodanov Kovov. Oh, could you please say it for me?
Anna Sadovnikova.
Kutuba Ongaili. Olympia Yakub Akov. Jacob Russell Williams. Rachel Schreier. Catherine Cleffy. Nora White. Bushra Abbas. Kate O'Connor. You can do this one. Nashia Akmal Chowdhury. Meenakshi Raj. Sneha Chala. Julia Manti. Danielle Jacobs. Michael Grisofi. Adarsh Kanjivaram. Andrea Momo. Gulaine Michael. Shayla Wilson. Yasmin Zamani. Julia Schroeder. Heather Boyd. Alexandra Marie Hayward. Abby Winkler. Unjali Bisht. Jennifer Andonian. Ashley Baumkamp. Jordan Bosco. Maria Frame. Allison Burke. Caitlin Jefferson. Jian Yun Tang. James Pendergast. Walter Accent. Roger Liu. Meredith Petty. Sherry Yin. Laura Gashom. Amal Abdallah Amsawi. Chia Lee. Ashley Thomasy.
Courtney Heel Baus. Yetunde Udutayu. Adriana Diaz. Gloria Meirela Villapando. Diana Fernanda Quesido. Alexa Erickson. Vani Murti. Chelsea Moyle. Melanie Chan. Shuan-Ni Nicole Lee. Robin Lee. Michelle Kadra. Samantha Kabala. Jillian Mayman. Fanaz Malik. Kaylin Marie Filato. Amy Starr. Megan Leigh Shawcross. Sally Asker. Elizabeth Wetzel. Katrina Daoud. Jennifer Eberly. Charlie Gaber. Elizabeth Lee. Erica Joy Concours. Martin Hawkins. Tanis Roosevelt. Catherine Turner. Amanda Meyer. Laura Camperdown. Hillary Armstrong. Sarah Blanks. Stephen Sullivan. Patricia Reynolds. Tri Win Liu. Tao Gia. Xiao Tang Liu. Jingyi Wang. Lily Fink Shapiro. Triana Kazela Sardinis. Elliot Evan Popoff. Kathleen Davey. Mark Hammond. Janet Comella Jansen. Catherine Jandu. Erica Schauman. Michelle Silver. Allison Moffett. Kim Kutsky. Catherine Yuting Lu. Suyang Wang. Dimitra Kurupu. Sarah Richardson. Emily Smith. Colby Chambers. Amanda Alice Milliken. Suzanne Lim. Shannon Patrick. Carolina Shantz. Ian Marshall Lang. Jacqueline Grace Dufek. Sarah Weselick Greenson. Catherine Elizabeth Beck. Crystal Moy. Teresa Kowalski. Ava Marie Pisutico. Pierre Mahuza. Guanne Mao. Dean Filbert, it's my pleasure to present the candidates for the Masters of Health Informatics degree. Xiao Zhen Hu. Gerald Schaefer. Jenny Vanderlist. Monica Gua. Ryan Collins.
Dean Filbert, it's my honor to present the candidates for the degree Masters of Health Service Administration. Keisha McPherson. Emily Stebbins. Noah Chiver. Yakuta Aziz. Emily Catherine Leadham Hurst. Rachel Dolan. Kovol Ali. Ayla Smith. Rachel Barnes. Grant Boyer. Srikanth Mari. Ronald Hubble. Kendall Troyer. Mark Connolly. Michael Yu. Zachary Tyler Klug. Zubana Ali. Cheryl Randall. Nikila Kasivokla. Thomas Riley. Anthony St. Jean. Lillian Chung. Tanvi Mehta. Preeti Padale. Saurabh Kukreddy. Jason Seo. Elizabeth Proctor Ferguson. Thomas O'Toole. Ryan Miller. Sean White. Patrick Koblenz. Sahil Manhas. Jillian Davenport. Daniel Mora. Catherine Liu. Rafael Dana Nieves. Heather Berger. Christine Greenow. Sarah Abu Al-Saud. Nina Phillips. Kathy Tu. Dayani Was. David Entz. Jared Roberts. Corey Blomquist. Brayton Statham. Kyung-un Kim. William Tyson. Dean Filbert, it's my honor to present the candidates for the degree Masters of Science. Katarina May Klimpel. Krista Ruth Mallory. Caitlin Collison. Sarah Abraham. Allison Cullen. Jedediah Carlson. Megan Alice Lacey. Brian Greco. Evan Reynolds. Tai Yoon. Zachary Mudai. Nicholas Seawald. Lauren Ziamba. George Harris. Anaja Tolpadi. Amy Gu. Dongyu Wong. Gregory John Mihailo Zajac. Paul Lin. Sarah Scarlett. Danting Zhu. Yu Zhou. Meng Chao Bai. Mingling Zhong. Gong Wong. Hongru Shen. Ryan William Stidham. Stephen Goutman. Mark Norris. Kathy Goldstein. Catherine Motrin. Rajuta Marji. Raza Abbas. Mohammed Tiba. Xin Xin. Yufeng Li. Le Yu. Faris El-Kider. Marwan Al-Hajali. Olabokula Nafiu and Company. Kate Wanchu Chung. Kenneth Woodside. Sarah Laneher. Abdul Rahman Al-Ruwaili. Ibrahim Dabur. Curtis Abed. Baxian Wei. Tianyu Shou. Yilun Su.
I would like to ask our guests and audience to sit. Graduates, remain standing. I would like you to turn around and find your family member, your dad's third cousin, was it? And thank them in any way that your heart desires. You may be seated. Graduates, I have no doubt whatsoever that you are going to accomplish extraordinary things. We are eager to celebrate those achievements with you. All of you are going to make a difference. It is now my distinct honor and pleasure to introduce to you a School of Public Health alumna who is demonstrating what it means to make a difference, whose own work is improving population health and helping improve access to health care. Marianne Udall Phillips is director of the University of Michigan Center for Healthcare Research and Transformation. She is also chair of the School of Public Health Dean's Advisory Board, my boss, a trusted confidant and resource to me and to the school. Marianne, I invite you to take the podium.
Thank you. Graduates, I have the distinct privilege of telling you a secret. You have now joined me and those 14,999 others you just heard about. You are now Michigan alums. Or, as some, I think mostly from other schools of public health, like to say, you have joined the Michigan Mafia. Welcome. And you know what that means. No, it doesn't mean that you're going to find a horse's head on your pillow. But it does mean that you're going to hear from us. So, because I had the wonderful opportunity to teach some of you and work with others of you, I know how talented you are. I know how compassionate you are. And so, while you're out there making sure the entire world is healthy, please give a moment of thought to those who want to follow you, who want to also have the opportunity to have a University of Michigan School of Public Health education. Please think about them and help them have that opportunity as well. Please be generous, give early, give often, and do whatever it is you can for them to have your experience. Congratulations, graduates. Congratulations, families. All the best.
Thank you, Marianne, for those inspiring words. You continue. I got verklempt. You continue to make your alma mater proud, and we are fortunate indeed to have you. In a few moments, we will conclude the celebration with a fine send-off from the University of Michigan Men's Glee Club and from our organist, Dr. James Kibbe. Please extend to them our thanks. When we do, we ask that the audience kindly remain seated until all the graduates have left the auditorium. We invite all of you to join us immediately after the ceremony for a reception outside this auditorium under a tent on Ingalls Mall across the street from Rackham Auditorium. Graduates will be exiting the east doors of Hill Auditorium towards the courtyard. So that all of our guests can exit the building comfortably, I encourage you to meet your graduates at the water fountain or in the tent rather than directly outside the doors or in the lobby of this auditorium. I'm delighted to remind you that as part of the School of Public Health's commitment to protecting and improving the environment, all of the plates, cups, napkins, etc. are made of 100% compostable materials. That means you've got something to do. It means that you need to deposit leftover food and used serviceware in the yellow compost bins. That's the same color as the school. Graduates, I've had the privilege of getting to know many of you, and I have a profound sense of the intelligence, talent, drive, and fundamental goodness of this class. The challenges before you are many, and some of them may seem insuperable. As public health professionals, you will face the challenge of working in a complex world where we have medicines to treat a wide variety of diseases, but where millions of people don't have access to health care. You will face the challenge of new and proliferating technologies that can both be helpful and a hindrance. You will face the challenges of injustice that are as old as human civilization. You will have to use what you have learned to help others, individuals, communities, and decision makers understand the difference between data, information, knowledge, and wisdom. You will have to use the best available tools in technology, but at the same time make personal connections. Rather than simply seeking the causes of disease, it will be your mission to understand the root causes of disease and, where possible, to address and redress those root causes. Often, your sacred task will be not to come up with solutions to the world's problems, but to manage dilemmas. But because of who you are and what you are capable of doing, and because of your collective power to innovate, I look forward to the future with an uncompromised optimism. It has been an immense pleasure and indeed an honor to work with you here in Ann Arbor during this phase of your careers. Thanks to this School of Public Health, we are now permanently connected to one another and to this place. Please stay in touch. You have chosen to dedicate your lives to bettering the health and well-being of your fellow human beings. I know of no greater calling. Congratulations on your graduation, class of 2015. Go Blue.